Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today's Incident Command Day 54, providing you the update from Albany Med on the coronavirus. In the 5 surrounding counties, we now have 2,477 people who have tested positive for COVID-19. Inside here in the medical center, we currently are treating 50 patients with COVID-19. We have 31 on the floor, we have 19 in the ICUs, and we currently have 5 on ventilators. That continues to be a number that comes down. We received a question on Facebook yesterday. It was from a local physician, actually a very good physician, and he said he's been watching the videos, and Fred, he wanted some clarification. He said that on the one hand, we're talking about the fact that the hospitalization numbers are coming down, but he's hearing more about numbers of positive cases in the region, and he wanted to try to reconcile that. So are we at the peak or not? That was basically his question.
So Dennis, I think it's a little complicated to answer the question, but I would say this. From a hospital admission perspective, I think we're past the peak. So today, again, on our call with all the other regional hospitals, the number of hospitalized patients has dropped yesterday compared to today. In terms of what's happening outside the hospitals, though, the number keeps going up, I think because we're just doing more testing. There are more testing centers in Schenectady and Albany County throughout the region, and I believe a lot of those patients being tested are asymptomatic, and as a result, obviously they don't need health care, so they're not coming into the hospitals. So it's probably a little bit of both. The hospital peak has been reached, and we're actually coming down, but there's still growth in the asymptomatic cases out there.
And so to that point, there's something I'll share with everyone. We got this today. We'll put the phone number and the website up on the video. This is from the New York State Department of Health. There's an opportunity for testing for the virus for essential workers. The phone number and the website will lead you to those locations if you meet the criteria. Thank you. So to that point, as we do more testing on an outpatient setting, there's no question the numbers will go up, but we're not seeing that translate into additional admissions, at least not in the last couple of weeks.
Not in the last couple of weeks, Dennis.
Fred, as always, we like to bring up new topics that are in the literature. You were talking to me earlier about a New England Journal of Medicine article specifically about blood pressure medications and its effect on COVID-19.
So I think everyone knows that hypertension is a risk factor for developing COVID and more serious manifestations of COVID. And there's been a lot of talk about one of the classes of medication called ACE inhibitors. It's a medication that inhibits an enzyme in your body that helps to lower your blood pressure. And the ACE receptor has something to do with the virus in your lungs. So this was a study out of New York City at NYU looking at almost 13,000 people. And what's interesting and important about it is it showed no connection between taking that medication and getting COVID, and nor did it show a connection between how severe your COVID infection would be if you were on the medication. So the take-home message is, if you have high blood pressure, take your medication. Don't be afraid to take those pills. They're definitely doing good for you and don't predispose you to harm from the COVID infection.
It's a really important message, and I'm glad you brought it up. And hypertension is a risk factor for stroke. And one of the groups that manages strokes is neurosciences, and I think we're wearing neurosciences today.
We're wearing neuroscience shirts today. Shout out to neuroscience.
And they take care of not just strokes, obviously, but a whole list of neurologic disorders. And so anybody who's in that field, they do a great job. Speaking of a great job, I bumped in today to someone who told me the story about a nurse in our pre-operative area. Her name is Joan. And she watches our videos, Fred, and she said that she was watching the video and it reminded her of the importance of being very careful with patients who come from nursing homes, particularly if they're going to have surgery. And there was a recent case that she was involved with where that patient was coming from a nursing home, and what we had spoken about spoke to her, and she took great care of that patient.
Yes.
Which leads me to the question of surgeries. And I know yesterday we spoke about the waiver process to be able to start doing what the governor calls elective procedures, but what we're calling medically necessary procedures. And we talked about there's criteria you have to meet at a county level, there's criteria you have to meet at a hospital level, and then there's obviously other conditions. So what's the update there, Fred?
So the county that we're in, Albany County, is what's called an ineligible county. So on data from April 17th through the 27th, there were certain parameters that the state's looking at that sort of disqualified us from starting up. So to start elective surgeries, the first thing that has to happen is your county has to be eligible.
Okay.
So we've been looking at some data, and we think actually the county is eligible with more recent data.
Excellent.
The second part of the waiver process is your actual hospital data. And as I said yesterday, I believe you need to at least have 30% capacity on your total beds and 30% capacity in your ICU beds. So we've actually now looked at our capacity, and when we compare our current census to our surge capacity, so our census today was 529, our surge capacity is 986. We think we meet that 30% requirement for total beds, and our ICU beds today are filled with 89 patients. We can surge to 169, so we meet it there as well. The third element that's necessary for a hospital to have a waiver is your census of COVID positive patients can't have gone up by more than 10 over that 10-day period. And again, when we look back now at 10 days from today back, our census has actually gone down. So we're preparing a waiver that we're going to submit to the state later today, and we believe we will qualify under that new guideline.
All right, excellent. Thank you so much. It's really important that we do this, and we hope that it will be approved, and we'll update you on that next week as well.
Yes.
So finally, it's May 1st. A couple of important things have happened on May 1st. Let's end the week on some fun here. Fred, did you know that in 1930, on May 1st, the term Pluto was used for the first time in naming what was a planet? I guess now it's a planetoid.
Planetoid. Yeah. Okay.
Elvis married Priscilla on May 1st. So I think I'm
Didn't know that.
It is actually International Sunflower Guerrilla Gardening Day. And guerrilla means go out and plant surreptitiously sunflowers in parks. So people are out there doing that.
Okay.
And it is my wife's birthday.
The most important.
The most important.
The most important.
So happy birthday to Karen.
Happy birthday, Karen.
Happy birthday, Karen. And so we'll end by saying happy birthday. We'll wish you a great weekend. Our hospital obviously runs 24/7. Our teams will be here all weekend working. We'll certainly be working. We'll be back on Monday. We ask that you please take care of yourself, take care of each other, and we'll see you Monday.